My name is Jahan Wood. I'm the program director for the Integrated Plastic Surgery program at UNC. Here, our top priority in this program is to produce well-rounded and competent plastic surgeons. We want our residents to finish this program after 6 years and be able to do what it is they want to do, whether that be matching into a competitive fellowship or joining a private practice. And several of our residents in recent years have actually gone on to open their own private practice successfully, which makes us incredibly proud.
All of our residents graduate with more than 2,000 procedures. You learn so fast that it shocks you how quickly you learn and how good you become.
You'll see all aspects of plastic surgery, general reconstruction, breast reconstruction, not only implant-based, but free flap reconstruction.
The relationship between the residents, even on my interview day, was very apparent. Everyone was very close. There's support between everyone. Everyone is, trying to work together for a common goal of doing what's right for the patient. I ran track in college, and so being a part of that team dynamic is very important to me, and always having people who are looking out for you.
It's really important that you have a welcoming general surgery program that you're going to be a part of, because you'll be spending a lot of time there, and I definitely felt that way here at UNC. I felt very, very welcomed, and I feel like I learned a lot that prepared me well for plastics.
I am known to most resident programs as Mama Kim. I have been at UNC now for 20 years. The faculty, the residents all say they want to be here because of the family, because of the camaraderie, and I think that that is really what sets UNC apart from any other place.
UNC is a state hospital, and I think we treat the people of North Carolina regardless of their insurance status. I think that's a main contributing factor why our residents see such high numbers. Our residents do not have a problem meeting minimum expectations or minimum requirements for graduation.
See everyone who has insurance or uninsured. Patients who don't have insurance or from a lower socioeconomic background will often have more complex health care problems that make them more difficult to take care of. And so you find that the patient population at UNC is very challenging. If you can take care of the patients here, you could go anywhere in the country or in the world. We see the most complicated cases in North Carolina here.
I'm Linda Emmets. I'm the chief of UNC Division of Plastic Surgery. I've been the chief for the past 3 years. I'm most proud of the people. I feel like we have a really solid division of 6 faculty members. What I really enjoy and what really keeps me here is the collegiality between plastic surgery and other services, whereby we perform a number of cases or operations with other services that not only offers the best patient care, but also certainly allows for a much more comfortable environment. All of us feel like we're never afraid to ask someone for help or ask someone a question.
I think one of the strengths of this program in this institution is how well we collaborate with our other surgical departments. We see a whole gamut of plastic surgery at UNC.
The good thing about UNC that I feel is different than a lot of other programs that I don't just have friends in the plastics programs. A lot of my friends are in different specialties like OMFS, general surgery, ENT.
We support each other, we lift each other up. We want everyone to finish here being a good surgeon and a good person.
As a female surgeon, I certainly appreciate that we have a lot of strong female leadership in our program. My interest in craniofacial surgery has been fostered, and I mainly have Dr. Wood to thank for that. She was just incredibly kind and someone who really from the beginning I looked up to. She's a power female surgeon. She juggles this really challenging job as well as having kids.
We have a really diverse faculty here. We've trained all across the country, and we each have our own individual focus, but collectively we're able to provide the full gamut of plastic surgery. So for instance, I have a very busy pediatric and craniofacial practice. We see a very high volume of facial trauma, some quite complex. We have an amazingly skilled hand surgeon who exposes our residents to not only acute hand trauma, but also teaches them how to take care of chronic hand conditions. Our microvascular practice is quite robust. Our microsurgeons are able to reconstruct really any defect on the entire body. And we, in addition, have a quite busy breast reconstruction practice where our residents are exposed to not only implant-based reconstruction, but free flap reconstruction. Our program is very good about balancing work and life. The faculty are busy outside of work. We know the residents have a life outside of work. And so We really stress the time that we're here at the hospital together to maximize our education for the residents.
Chapel Hill is an excellent place to live. You're close to the beach, close to the mountains. One thing I was pleasantly surprised about is how much music is here. Some amazing concerts come here. There's so much fun to be had here.
I really love the town of Chapel Hill a lot. Making your life outside of residency easier in terms of just things like rush hour, being able to drive and park somewhere, not being able to have to dig your car out of snow. I think those factors are really important to consider. It's great for people who are single and young, and it's also great for people who are married with families. And it's just a really diverse place to train, and it's been a great 6 years so far.
I really enjoy that ability to not only see the residents really grow and evolve and mature, and then graduate, and then still be able to see them at meetings or giving presentations and really feeling like we still have that connection or that bond. Just that ability to not have it end at the end of residency, but to know that this is a relationship that will last for the rest of our careers is really gratifying for me.
If there's one thing about residency that everyone knows, it's that it's hard. And the only way to make it through is to have support. Here you have such an excellent group of people, not just your co-residents, but your attendings as well. They all want you to succeed.
I think the UNC plastic surgery has a really bright future, and we're all very excited about the upcoming match.